Funding for the nation's network of community health centers is set to expire Saturday. Hundreds of thousands of people, including children, rely on the federally funded program here in South Florida alone. And if funding is not renewed, it's estimated that 51,000 jobs will be lost, 2,800 centers will be closed, and 9 million patients will be left without care around the country. President Trump also announced today that he is likely to sign an executive order that will allow insurance to be sold across state lines, presumably increasing options and competition in the marketplace.
This is the latest development since the Senate's most recent plan failed, even before being called to a vote.
Well, the health care debate can be overwhelming, especially the politics involved here. Joining us now is Dr. Eneida Roldan, the Chief Executive Officer of the Florida International University Health Network. And Dr. Roldan, thank you very much for joining us.
My pleasure. Thank you so much for inviting me.
I want to start by asking you about this executive order that would allow insurance to be sold across state lines. How big a difference do you think that'll make?
Well, I think that now, after seeing what has happened with the implementation of Obamacare, a lot of insurances understand that now there's a mixed population out there that is very different from what they were used to, because this was a population that basically was uninsured previously, and through Obamacare are now insured. So personally, I think that with what has happened, they may be very cautious. It will create competition, because we understand that through Obamacare, there's been some states that basically only have one insurer right now, and therefore, with the lack of competition, premiums will go up for those individuals. So, although it may create competition, I think the insurers themselves may be very cautious as to what their next steps would be.
And what about the healthcare providers on the ground level? What are they doing to lower costs for everyone?
Well, that is at the core of what it is. I mean, we are looking at coverage, we're looking at who's going to be covered, we're looking at what's going to be covered, but at the core is that we need to focus on the cost of the healthcare delivery. We need to do something about our efficiencies, our duplication of care, of how we're really treating our patients. And therefore, until we really tackle all the pieces surrounding healthcare, it is going to be very, very difficult and continue to be a complex situation.
And that was one of the drivers of the debate when it comes to Obamacare, the Affordable Care Act, that premiums for regular people are going up and up and up to the point where they can't afford their insurance. They may have it under Obamacare, but they can't afford it. And we just saw this week the latest attempt on the part of Republicans who run the show in Washington to get rid of Obamacare and put something else in there has failed. And there are more Obamacare enrollees here in South Florida than anywhere else in the country. So what do you say to those people here in South Florida who are dependent on Obamacare, and those people who have watched their premiums go up and just can't watch it any longer?
Well, it's interesting that because of what just happened, which means that they have completely disregarded as to taking it to a vote, those individuals that are currently on Obamacare will not see that great of a change. Yeah, there might see some increase of premium because, again, the population's not diluted. We have more of a sick population rather than a healthy population. But I think really that the concern is to those that are outside Obamacare, that basically, because we do still have individuals that go and buy their insurances because of such uncertainty in the market, because we still don't know what's going to happen to that population, premiums will go up. It's a way of protecting themselves to a greater loss.
Well, Republicans have failed 3 times to repeal and replace. I mean, what do you, with so many years of experience in this field, think would be practical improvements to Obamacare?
Well, I think that first of all, we should focus on the fact of how can we incentivize that population that is young and that really is healthy in order to dilute the pools of the risk. Insurances is all about risk, and therefore we need to dilute that risk pool in order for insurances to be still profitable, because they need to still be profitable. So I think the focus of increasing the penalty if you are not insured should be higher than what the premiums are.
That goes against the thinking.
In other words, we should incentivize by increasing the penalty greater than what a high premium would be. This way, then, with the individual mandates, they would actually, the young people, the people that right now are not insured because they'd rather pay the penalty, will be able to dilute the pool. And hence, we can move forward.
Well, they want to get rid of the mandate in the Republican senators want to get rid of the mandate.
So we are still going to be back to first base.
Okay.
We'll see what happens. And the president said he'd be willing to sit down and talk with Democrats about this. And so maybe a deal is in the works.
We hope.
Dr. Roldan, thank you so much.
My pleasure.
to meet you.
Anytime. Thank you.
Thank you, Doctor.